but welcome to the first webinar. And this webinar is to answer questions. And so the first question that we had posted today was, can one experience gout in unusual places like the elbows or the spine? So welcome to today's webinar, and it's specifically to answer this kind of questions. So if you are struggling with gout pain or you know someone that is, have them join our Gout Warrior support group, and we're going to be giving expert advice on things they need to know so that they can thrive despite having gout. So the first question is, can one experience gout in unusual places like the elbow and spine? So my name is Arinola Dada. I'm a rheumatologist, and this is a very good question. So as we know, the answer is that uric acid is causing gout, and uric acid can actually precipitate in different joints. So the short answer to this question about whether one can experience gout in unusual places is yes. And yes, but it depends. It is more likely to happen in people who've had gout for years. Let me explain. So when a person starts to develop gout, uric acid forms these dagger-shaped crystals that precipitate in the joint. The uric acid precipitates typically in the small joints and the colder joints. So we think about the feet and the toes. But over a period of time, those uric acid crystals start to saturate those joints. And so it's almost like the uric acid crystals has kind of run out of small joints to bully. And then it starts to precipitate and crystallize in other joints. And those joints can include the knees, elbows, fingers, wrists, and even in the spine. So yes, the answer is uric acid. Gout can precipitate in those joints, but it's not typical. And so if you're having joint pain and you're wondering if it's due to your gout, you probably should have it evaluated by your doctor and really tell your doctor, hey, these are the symptoms that I'm experiencing. People with gout know that the gout symptoms tend to be more intermittent. So you get an attack, comes like a sledgehammer, goes away, comes back again like a sledgehammer, and typically lasts for weeks. But the sooner you treat it, the less likely it becomes a chronic issue. So hopefully that question about can one experience gout in unusual places like elbow and spine, the answer is yes. But we cannot take for granted that just because you have gout, that it actually is present in all those other places. So still needs to be evaluated, because unfortunately you can have more than one kind of pain, more than one kind of arthritis. Okay, so that's the first question. The next question that we had was, how do you manage frequent gout pain, especially in the feet and joints? So I think this is a good question, but the response is twofold. The first thing is how to manage the acute attack. And the second very important question is, how do we prevent recurrences so we're not dealing with frequent attacks of gout pain? So we're going to start with the easier one. How do we prevent the attacks in the first place? Well, you kind of have to stay on your medication and stay on your diet plan. So as most people know, and as I preach, gout is only 10 to 15% dependent on your diet. Now, assuming your diet is not crazy where you're drinking and you have, drinking a lot of beer on a daily basis, that kind of thing. In that case, then stopping beer would make a huge difference. But for people who are otherwise modest, I just say, hey, let's take away the known active provocateurs of gout. So high fructose corn syrup, we have no business eating that anyway. Beer, shellfish, organ meats. Those are the ones that we know that really precipitate gout. So one, that is the most important thing that you can do with your diet. And the second thing is going to be staying on top of your medication. If you've had gout and it's been severe enough and you've had multiple attacks, I'm sure that you're already talking to your doctor. One of the things that I do with my patients is that in addition to talking about how we prevent gout long term, which is putting people on medications to stop uric acid production, typically medication called allopurinol or Uloric, febuxostat if you're not in the United States. Those are the medications that stop your body from making any more uric acid. And then, so those eventually will prevent future attacks. But for the acute attack, I recommend for my patients to take colchicine. And back in the old days, people would take like colchicine like every hour until they have diarrhea. We don't need to do that anymore. But colchicine still plays an important role in prevention and treating the acute attack. But because of the diarrhea and abdominal discomfort associated with colchicine, some people can't tolerate a high dose of colchicine. And so that leaves the option for people trying something called prednisone. I usually give my patients prednisone so that if they have an attack and I'm not there, they can take the prednisone, at least start the treatment. In addition to prednisone and colchicine, though, FDA has approved a medication called Ilaris, which is a shot. It's very expensive, but usually insurance covers it and the copay cards cover it. And those are for people dealing with the most severe of attacks. It's usually one shot. Like I said, I don't recommend non-steroidal anti-inflammatory medications for people with gout because they, one, have been using it for a while and a lot of them have caused kidney problems for themselves taking these medicines. But the second thing is that people with gout may also inadvertently have some kidney disease, and we do not want to make this process work. So that's how you treat the acute problem. The chronic problem is more, how do we stop the uric acid from recurring and uric acid accumulation from recurring? And then finally, if you have lumps of gout, then using a medication that melts away the uric acid would be important. Okay, then, so other than medication, what else can you do, Dr. Dada? So keep comfortable footwear handy. Like, it's worth investing or buying shoes that give you the support but also have enough room to accommodate swelling. Because if you have to, for instance, go to your doctor's office, I've had patients actually walk into my office holding their shoe. And if they do that, I know they have gout, because gout is just one of the most excruciating arthritis that you just don't even want anything touching it. For the acute problem, I would recommend using a cold ice pack initially. That just reduces the swelling, because the swelling and the stiffness is contributing to the intensity of the pain. And then in between attacks, we recommend heat therapy and stretching, because we don't want your ligaments and tendons getting stiff because they were exposed to all that inflammation. And then, so practicing the gentle exercises. And of course, we talked about monitoring the diet, avoiding the high fructose corn syrup, keeping well hydrated, especially during attacks, would be important. So those are important strategies that help people deal with gout and manage that acute pain. Third thing, and they're kind of similar. I think questions 2 and 3 are similar because people wanted effective strategies when dealing with gout flare-ups and attacks. Well, I would recommend that in addition to what I already said, the most effective strategies to dealing with the acute gout is treating it as early as possible. My analogy is comparing it to a fire. So you could have a small fire in the kitchen where you can use a fire extinguisher to put it out, or you could have a big massive fire where the whole house is on fire and now you need to call the fire brigade. This is the same thing when you're dealing with gout. Some people, I tell my patients, I said, when you feel that twinge, when you're like, I think my gout may be acting up, that is the time. That is the time you start taking your colchicine. That's the time you start taking your prednisone, because eventually it means that you'll be taking less medication, the acute will be less intense, the attack will be less intense, and you'll be able to manage that rather than a situation when the pain becomes a 10 out of 10 and then you have to go to the emergency room. So treating early and quickly is probably the most important thing to do when you have gout. Next thing is to rest the affected joint. So when you're having an attack, especially in your feet, that is not the time to remember to go do that exercise program. When you're having an attack, you need to rest, because the crystal mobilization is making the situation worse. So you need to rest, and in fact, elevate the affected limb and have your foot in the air so you can reduce the swelling and the inflammation. I already mentioned applying ice, but the logic is that the ice will help to reduce the inflammation, reduce the swelling, because the swelling in the joint stretches the capsule, and that is part of the problem that people with acute intense gout are dealing with. Staying hydrated will be important to help flush out that uric acid. So the fourth question that we had is, well, how do you navigate social events when gout is acting up? And that I feel for people, but I do recommend to my patients to plan. Plan ahead. So one, you may want to bring any necessary medications with you. Two, you want to opt for the gout-friendly food and drink. I had an interview once, I think, with a doctor, Dr. Brookferer, and she had said that she recommends to her patients if they want to drink, we typically recommend water, but if they want to drink, then maybe a shot of vodka in like a spritzer type of thing, where that way you can still feel like you're participating. I think we were talking about the Thanksgiving event. How do you help your patients through that? If they feel they have to drink, have a little bit of vodka in like a spritzer, for those who feel like there's a social pressure of wanting to drink. Otherwise, staying hydrated with water is plenty. Wearing comfortable shoes, right? So wearing shoes that will not exacerbate your pain. But most importantly, getting away from that gout shame. Don't be afraid to explain to your conditions to your friends or your host if needed. So you said, oh, why aren't you eating, this? You're like, well, I have gout, and so I have to kind of be careful with what I eat. Like, why aren't you drinking the punch? Well, that's full of high fructose corn syrup. This is why you're going to maybe take the spritzer instead. There's nothing against your punch. It's just that this kind of high fructose corn syrup drinks may exacerbate my gout. So knowing your limits, and it's okay to leave early if you're uncomfortable. Okay, so remember that your health comes first, though. True friends will understand if you need to make accommodations. And finally, I think we're going to answer one last question, which is, what are the best ways to make your home gout friendly? Well, the easy thing is to avoid putting things at home that would most likely trigger a gout attack. So, one, you want to stock up on foods that are low in purine. And so when we say low in purine, though, I do want to be careful that in general terms, your body can process plant-based diets even if the plant-based diet is full of purine. So for instance, asparagus. Your body can process that and not from uric acids. But if you eat the same amount of protein in animal foods, then your body doesn't process it as easily. So rule of thumb that I tell my patients is, let's focus on having a plant-based diet. That on its own, with minimal animal protein, will, without nitpicking, would automatically lead to a lower uric acid level. Two, footwear. So making sure even at home you're wearing, supportive shoes, and these shoes are easily accessible throughout your home. Consider, like a long-handed shoe horn or grabber tool if you're having frequent attacks. The kind of food that you keep at home. So I remember reading something that says most crimes happen at night, and part of it is, even though that was a joke that person was making, was really talking about our willpower. And so if during the day you've been disciplined all day, and then at the end of the day, your guard is down, right? Because you've been good all day, you've worked hard all day, and so not keeping tempting foods in the house would be probably the number one thing that you can do to prevent your home from being a place where you end up with gout triggers. So if, for instance, if you say, okay, we're not going to have any high fructose corn syrup soft drinks in the house, it means that at 10 p.m. when you're tired and thirsty and you want to grab something, well, there will be no high fructose corn syrup drink in the house for you to reach out to, right? Okay. So keeping the house free of things that are gout triggers. Like for instance, shellfish. You probably shouldn't have that. Beer, you shouldn't have that. So not having those things in the house will make your house more gout friendly. And at night when you're tired and you just want to reach for something, you're not going to reach for one of those things that is going to trigger your gout. So hey everybody, I hope that these questions have been helpful. This is one of our many webinars where we're going to be giving people just the most helpful tips so that they can thrive despite the fact that they have gout. So again, if you know anybody dealing with gout, tell them about the Gout Support Group. We provide webinars, free downloadable information. I think we have a checklist coming up on what you need to know when your doctor is starting you on allopurinol. Like, for instance, did you know that there is a gene that your doctor should check? Because if that gene is checked, it's called an HLA-B5801. If that gene is checked, then perhaps you are less likely to get an allergic reaction to that medication. So there's so much information that we are providing for you on the Gout Support Group. So again, if you like this video, share it with somebody, make a comment. We look forward to seeing you next time. Thank you so much, everybody. My name is Dr. Arinola Dada. Have a wonderful day.